We have in the studio Miss SITI AISHAH IKAML HISHAM, a pharmacist from the Kuala Lumpur Hospital. Assalamualaikum, Siti AISHAH.
Waalaikumsalam warahmatullah.
Right. Thank you so much for coming on our show.
Yeah, no worries.
Right.
Thank you for inviting me.
You're not having a headache right now, right? You're cool, right?
No,
Okay.
we're good. We're good.
So I'm good.
Awesome. You're good. You're not a headache.
I'm not a headache giver.
Headache giver. Exactly.
Yeah.
So Aisha, that number is actually quite very. When I first read it, I was like quite staggering. It's on Harvard Medical, by the way. It's not like some.
So it's not a lie.
Yeah, it's not a lie. 300 types of headache, but only 10% we know the cause of. So I'm actually curious, what are the causes of headaches? Why do we get headaches?
Yeah.
Oh, that's something that's not easily answered. Like you mentioned, I think you mentioned the fact that we do have some types of headaches that are primary types headaches, which means they're not caused by any other underlying disease and an underlying condition of the brain or the nervous system. That's primary headaches, whereas secondary headaches, they might be caused by something more sinister, like something wrong with the brain or the skull or the nervous system. Yeah. So depending on what, actually knowing what type of headache it is and what is the most likely cause is actually very important, because that's how you isolate what is the most likely treatment that will actually be most beneficial. So actually you do need to start with identifying what kind of headache that is the patient is experiencing.
Yeah, because like you said, I mean, like there's an array, I mean, like there's levels of it when it comes to headaches, because like you may be at level 1, which is just nothing, but when you are at level 10, which is something like literally physically and medically, you know,
right?
it's something that is going on with your brain.
Yes.
And how would one identify that in regards of what level that you're on in regards of having a headache and how serious it is?
Like you mentioned, I think a lot of people sort of underestimate how debilitating headaches can be. It can be a massive loss of, you know, productivity, revenue, because it's just so debilitating. Once you get it, you really, it can be as severe as you can't work, right?
Yeah.
So how do you identify severity? Obviously, firstly, it depends on your perception of the pain, yes, and it also depends on how often it comes. Certain headaches, they can be episodic. It comes in periods or clusters, and certain headaches, they can be even more frequent, and it can also vary at types of location or the type of pain you're experiencing. It can be the sort of like you're getting if you feel like a band in your head, or it can be like a drilling sensation. It varies quite widely. So you do need to talk with a doctor or pharmacist or healthcare professional to isolate what kind of it, and if necessary, get more tests or imaging done so that we can probably identify what is the underlying cause.
Interesting.
Yeah.
So most of the time when we refer to headaches, a lot of people will go like, oh my gosh, I have a migraine today.
Yeah.
But in fact, the usage of the word migraine is not correct, right?
Yes.
So can you elaborate to our audiences at home how to differentiate, or what are the type of headaches that are known right now?
Okay, so I think it has fallen into sort of like the common vernacular, such as when people say, oh, I'm OCD, but it's not a medical term. So you are correct. A headache can be divided into many different types, and a migraine is only one of the type. There can also be things like tension headache, where it can be caused by certain triggers that can be identified. There can also be cluster headaches. There can be migraines, which is one of the most severe. Sinus headaches, hormonal headaches, things like hypertension, uncontrolled blood pressure can also cause headaches as well. So they do have different sort of variability in where the pain originates, and that's how a doctor knows how to diagnose what kind of headaches it is. What's the location of the pain? What is the type? Is it painful? Is it throbbing? Is it lancing? Is it sort of like a tightness? And how long does it last for? Does it go on its own, or do you need sort of treatment to abort that episode of pain?
As you can see on the screen right now, we have like different types of headache. It was shown earlier, there's like tension headaches, cluster headaches and whatnot, and the different placement of where the pain actually comes. You have like the eyes, you have sinuses that is normally around your nose area, and you got hypertension at the back of the head.
I can see that you have one on your jawline as well. So that's actually also an interesting location to figure out where your headache comes from, right?
Yeah.
Yes, exactly.
So,
yes.
so my question is that, depending on where the pain is, I mean, like, when you talk about headache, is it literally the whole head, or just at your temple or around the brain area where your skull is? So what are we talking about when it comes to headache over here? Because again, Zoe just pointed out, there's you can have headaches where you have pains in the jaw or the nose or the eyes. So how would that work?
Oh yes, definitely. Let's say if there is a problem with your sinuses or you have a problem with your nose or throat, that can actually present as a headache or a pain near your sinus cavity, which means that you have a sort of a sinus headache. And again, it's not a sort of like one size fits all. Everyone can present with headaches everywhere in the face or the head. Actually, that's the definition of headache. Actually, a pain in the face or a pain in the head, they can present anywhere. So yeah, identifying the location is one of the key sort of diagnostic questions that a doctor will ask you. So let's say a patient, we're talking to a patient where they're experienced debilitating headaches. We do try to sort of counsel them to try to keep a sort of a diary, so that they can write down how long it's lasting for, where's the pain most localized, what sort of pain is it like shooting, burning or lancing, so they can bring this to the doctor and discuss to get a better diagnosis.
So what are some of the common causes of headaches? Because I read actually it's nothing to do with your skull or your brain, but essentially it's the blood flow to your brain that causes the headache. Is that correct or am I wrong?
Oh, there's multiple causes. Like you said, how many hundred of types of headaches?
Within the 300 Neo.
Yes.
Towards the end.
Towards the end. So it could be as simple as being triggered by a reversible cause, such as attention type headaches. One of the most common causes will be emotional stress. So it could have something to do with the stress just triggering sort of a pain in your head that's sort of like constricting. It could also be due to an underlying abnormality in your jaw or your skull, and that's obviously more sinister, and we do need to do some imaging or tests to exclude anything that out. Or it could be triggered by anything such as, there's a lot of triggers, lack of sleep, lack of proper hydration.
Stress.
Yes, exactly. Yes. Even, very innocuous things like, unfortunately, chocolate can trigger migraine.
Wait,
Chocolate can cause stress?
Yes.
I thought
migraine.
it helps to
Can
release
trigger,
stress.
In certain unfortunate people, yes.
Okay.
So,
Trigger.
so this is one of the benefits of having a headache diary. So we can isolate what is actually that trigger that causes it. Is it something that we normally associate with a positive emotion, like chocolate? Or is it a negative thing, like emotional tumult or disturbance?
Okay, coming to that, the fact that you are a pharmacist coming up from HKL, let's talk about medication here. Because again, normally when people associate, when people have migraines or headaches or whatnot, you just tend to pop a pill, pop a paracetamol or ibuprofen or whatever it is that you can find over the counter. But what actually would be the best medication over the counter or whatever it is that's being prescribed, depending on what kind of headaches that you have?
Ooh, when you ask me the question, what is the best medication for headache, it's very hard to answer because there is actually, it's a trick question because there is no best medication for headache universally. It does depend on the patient, depends on the patient's comorbidities. Do they have any other individual situations, like for example, are they pregnant, are they breastfeeding, do they have heart or kidney problems? And again, going back to what kind of headaches do they have? Usually most of the simple episodic ones, the ones that are not chronic, it can be treated with over-the-counter pain relievers. So things like you mentioned, paracetamol, it's one of the most common drugs, and usually in most of the population, it will be safe as long as you don't exceed the dose. Otherwise, we do have certain types of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, like naproxen, diclofenac, meloxicam, ibuprofen. That also works as long as you get appropriate counseling from a pharmacist, because again, not all people are suitable to take it depending on their underlying health conditions.
So in that scenario, when I have a headache, and in this case, who do I see? Do I just,
a GP
do I just go to a pharmacist, or if it's too bad, then I'll go to, the nearest doctor, nearest clinic, nearest hospital. I have a really bad headache, so what do I do now?
Sure, if it's something that as soon the onset of the pain has started, it's best you take the pain relief, because usually drugs are most effective the earlier you take them. So you can definitely go ahead and see the nearest pharmacist for over-the-counter drugs. Like I mentioned, paracetamol is a great drug as long as you don't take it above the recommended dose, and as long as you don't have any liver impairment. Other drugs might be NSAIDs. They can be useful for a great majority of patients as long as you talk to your pharmacist, see if you have any considerations that need to be, considered about. If that pain does not go away, or if you find yourself needing to take more those kind of over-the-counter relievers more than 2 or 3 times in a week, you do need to see the doctor for further investigation. Yes.
Okay, let's talk about, again, when we talk about medication, Malaysia is one of the countries which is well known for having, or people using a lot of traditional types of medicines, I mean, like, regardless of whatever it is that you are, whether you're Malay, Chinese, Indian or whatever, there's always in a culture that we promote that, you should not take all those drugs that you buy in the pharmacy.
Yes.
You can take, this kind of leaf, this kind of tea and
take
whatnot.
chamomile, grey, take bananas.
Yes.
How does that work? I mean, like, does it actually work? Is it highly recommended? As a pharmacist, what do you say about that?
Okay, so my professional opinion is that a lot of traditional medications, unfortunately, we don't know what's in it. It could be, this is just anecdotal evidence, but I work with a lot of the elderly, and they say, I took this medicine and now my pain is gone. It could be headache pain, it could be joint pain, anything. But then when you look at that medication, you look close at the ingredients, you look at the analysis, it has steroids in it. That's why the pain is gone, because of the steroids, isn't it? So actually, when you have traditional medication that is adulterated and at an unknown contaminants, at an unknown dose, it can actually do more harm than good. So professionally, I do not recommend these sorts of medications just because it's unknown what kind of effect it could have on the patient.
So but it worked on my grandmother, but it worked on my grandfather, it worked on my cousin. Those are the kind of things that you normally hear.
I love this one. I don't know if it applies to everybody, but in my household, if you have a headache, then you put the egg and a knife on top.
Really?
Yeah,
Really?
So
How was that?
So you boil the egg.
Okay.
So it will be a hard-boiled egg, and then you just put it on your head, and then I don't know. My grandma put a knife on it, so you just put it there, and it will rest, and it will help to relieve.
You've heard about this?
I have never heard of it.
So these are the kinds of things that it's. I guess I can't really say no to my grandmother.
Yes.
If it works, kind of stuff, right?
I feel like that's just going to be more dangerous in the more long run, right?
In retrospect,
There you go.
Coming into more traditional things like food. So food is a great source of headache reliever, right? It's not permanent, but can help to relieve your headache or any illness. So any food recommendation to our audiences out there, some of the fruit, vegetable that they can take to relieve headache or at least ease their pain.
Take more of, take less of.
Take more or less off. Obviously, we're going to go with the very, very standard advice. Don't eat your high, fried, all those fast foods and everything. High salt is actually one of the triggers of headaches. Other than that, actually...
Lamb. But that's nice.
You just watch your blood pressure.
Blood
pressure can be a cause.
My BP is fine.
Blood pressure can actually be a cause
okay.
of headaches. Other than that, skipping meals is actually one of the triggers of headaches, right? So you just use very common sense dietary recommendation. Don't skip your meals. Have a balanced diet. Make sure you drink enough 7 to 8 glasses of water. Lack of hydration can also be something that can trigger a lot of headaches. If you skip your meals, skip your drinking, you get dehydrated, that can be a headache in of itself.
Even bosses at workplaces, I mean, like, they can contribute to headaches as well.
I'm sure my boss is watching me right now, so
Exactly.
yes, I'll
No, I didn't say that. No.
I'll be.
Eat more greens and anything potassium-based is also great, right? Like bananas.
Just make sure that you don't get fruit and vegetable is always good. Yes, just make sure if you are on certain dietary requirements, like people with certain kidney impairments, they can't take too much of a certain electrolytes.
Okay.
So as long as you work in close consult with your doctor, who will be monitoring your electrolytes levels, it should be all good.
Okay.
Awesome.
We've talked about medication, but let's talk about prevention right now. Like, how do you not be in that position where you could get a headache? What kind of lifestyle or what kind of things that you should, have more in your life or take away in your life to have a better lifestyle to hinder yourself from getting too many headaches? I mean, you can't run away from it, but at least you can control it in certain extent.
True. Speaking from a pharmacist's point of view, if you have been diagnosed with chronic type of headaches, for example, chronic migraines, there are certain prescription medications that doctors can prescribe you, like beta blockers or certain drugs that act on the brain and sort of reduce the occurrences of those headaches. So if the doctor has prescribed you that, it's always good to not skip those doses. It will actually prevent future episodes from becoming more severe. And if for just general common sense advice, again, get enough sleep. Lack of sleep, again, is one known trigger for headache as well. Get enough hydration, 7 to 8 glasses of water a day. And this is plain water, not Coke, not Sprite or anything like that. Don't skip your meals. Don't skip your breakfast. I think breakfast is one of the meals that we generally do skip nowadays. Yeah.
Yep.
My stomach is rumbling right now. I'm skipping breakfast.
Oops. Yeah.
And of course, leading a healthy lifestyle as well. Like
Definitely.
exercising.
Yes,
does help,
exercising.
right?
Yes, the recommendation is around 30 minutes, around 5 times per week, I believe, right nowadays. So that all, just a general healthy lifestyle will do wonders. Yeah.
So any, I know this is probably not within your job scope, but so when a lot of people get headache, the first thing they do is they rub their temples. So they will rub a certain region that hurts. Would you recommend for our audiences to continue doing that to relieve the pain, or is that something that's not really, it doesn't really help, but it's just more on, it's just something to soothe us,
Self-soothing behaviors can actually be very helpful if it works for you. Certain other techniques, like you get a cold compress, you put it on your temple or your head, that actually could help as well. So there are certain, non-pharmacological therapies you can do. Certain migraines are triggered by light, for example. So if you need to stay in a quiet, dark room, no movement, no noise until that episode of migraine goes away, that would definitely help as well. Yes, lying down, cold compress, and also relaxation techniques. And these techniques, you can either talk to your doctor about how to implement those techniques, or it's called cognitive behavioral therapy, and this can also be quite helpful as well. And just in general, I think a lot of people live a very fast-paced lifestyle. All this relaxation techniques, deep breathing, thinking could be very, very helpful.
Okay. I just want to ask your opinion on something. This is coming from experience, not myself. It's actually a friend of mine when we were back in school. This was ages ago. I had a friend who, when he had a migraine, it's as if like he had to really shut down. He had to lock himself in a darkened room. He had to put a wet towel over his head. I mean, he can't open his eyes and everything. It was that severe. And it happened at a very young age, being in his early teens, between 15 and 16. As early as that, someone could actually get such a throbbing migraine. Now, migraine doesn't recognize any age when it attacks?
Unfortunately, it cuts through the spectrum of ages, genders, although, and races. It's something that, and again, the specific mechanism is not really something that we know of. But again, like I mentioned, I think a migraine specifically is one of those headaches that's very severe, it's very disabling, and it makes you feel as if even the slightest movement or light makes you want to, throw up. So it does need to be distinguished from your general regular headache type of pain, general relievable type of pain, so that it's not the misuse of the word migraine is sort of like,
Can we clarify to our audiences what is a migraine and what is the feeling, so that they don't just go like, oh, lama, I got migraine, like today I cannot work.
I mean, people, again, like you said, they loosely use that term every time they have a headache and calling it a migraine. So what is a migraine?
Oh, I think you've described it pretty well. It's something that is very severe, disabling. You can't look at light. It will make you very, very... And it comes, dizzy, and it usually comes with sort of the sensation of you want to throw up. And it's usually in one side of the face, and it can be behind the eyes. So it's something that, as you can imagine, it's just horrible. So usually what we want people to do when they experience that sort of episode is lie down, strictly no light, no movement, no loud noises, in a dark room, put a cold compress and you can take pain relievers, like I've mentioned, Panadol or NSAIDs will work great. But usually it will need long-term preventive treatment. So again, you do need to see the doctor. Certain classes of drugs are good at this. It's prescription, so you see the doctor.
Funny thing is, my friend, the one that I was describing, who had this high, severe cases of migraine, he's now working as one of the diplomats for the nation. So talk about stress-free life. That's a very stressful life, and he's able to actually succumb to that. So kudos to him. Good night. This is to you.
Shout it out. So our last question, right? Do headaches, are headaches related to any other really severe like diseases or problems or medical,
Yeah. Can it be a
issues,
sign for something worse?
Yeah.
Oh yes, yes. Not to scare, because the majority of headaches are pretty benign. Like you
Okay.
said, it's primary headache, so you're not really sure what caused the. You know that
Headache,
it's there. But some headaches can actually be an underlying caused by an underlying condition, like for example, a bleeding in the brain, or
Oh,
a
wow.
fracture in the skull, or anything that that needs certain tests like imaging to be ruled out. So if any patients report of their first headache being the worst headache ever, like they're reporting it's really, really severe, or it doesn't go away even after pain medication has been taken, they do need to seek medical attention as soon as possible, because it might not be something benign. It might
Right.
even be a symptom of uncontrolled hypertension, which could be precursor to things like that you don't want, like,
Regardless of age, like you said, right? It
Yes.
could happen to a
Yes.
young
Yes.
kid. It could happen to an elderly person.
Yes, exactly. We should have sort of like not really buy into the thought that kids are healthy, or young people are healthy. These.
Have you had cases where kids have such severe migraines or headaches?
Oh yes, yeah. So they do need to seek immediate medical attention. So your nearest hospital or doctor should be consulted as soon as possible.
Right.
Yeah, just to
Okay.
exclude anything more sinister.
Yep.
Yep.
Any last advice to our audiences who are very scared
Yep.
and refuse to go and see doctor? They want to
Please
take
tell
that
them
thing,
sternly over here.
Sternly,
Yes.
okay. I will try to put on my sternness. No, I can't do stern. Okay, yeah. So headaches can be benign, or it can be a symptom of something more severe. So the best way to sort of figure out what is talk to your pharmacist, talk to your doctor. We do have access to a lot of treatment options, not just medication, but even non-pharmacological options that can be worked together. And you don't even need to see a doctor for a lot of it. There are OTC, over-the-counter pain relievers, available that can help you. And remember, headache can be very disabling, so don't hesitate to seek medical attention. And if you need further consultation, we have the National Pharmacy Call Center. You can give us a call from Mondays to Fridays, 8 a.m. to 5 p.m.
All right.
Yes.
There you
Awesome.
go. Yep. Siti
you so
Aisha
much.
IKAML HISHAM, pharmacist from the Kuala Lumpur Hospital, with the topic of best medication for headache. Thank you so much for coming down.
Thank you.
Aisha,